Well, hello and welcome to this edition of FOP TV On Demand. Today, we'd like to talk to you about the plans of the Grand Lodge Fraternal Order of Police of creating a nationwide healthcare plan. With us today is our Chairman of Trustees, Rob Pride, and also Steve Gervasio, who also is he's the FOP representative helping us work through our insurance plans. And myself, I'm Patrick Yoes, the National President of Fraternal Order of Police. You know, for quite some time now, I've been on the board for 16 years, and over that 16 years, we have constantly been asked one common question, and that is, why is it with a membership of 355,000 members nationwide, can we not leverage the amount of members we have and create a healthcare plan for our members to be able to take advantage of? You know, we all work for agencies, and all of which probably, if not all, most if not all, offer healthcare benefits to their members. The problem is when a person is eligible to retire and they pre-65, they're not eligible for Medicare. There's that big gap where our members are staying on a job only because they can't afford health care. So what we entered into a great deal of discussion of trying to find a way to provide this benefit for our members to cover that gap in between, and we were successful in working out an arrangement with Aetna. And this program is designed to where there's come in two phases. The first phase is to use the numbers off of the post-65, the Medicare eligible members across this country, and use that for our underwriting to be able to articulate the move into a pre-65 nationwide healthcare plan. So today's episode is going to be to talk about just that, about the development of a path that is going to hopefully finished by the end of this year, reach the benchmark that we need in order to trigger the development of a nationwide healthcare plan for our members that are under 65. So with that, I'd like to introduce Rob Pride. Rob Pride is our Chairman of Trustees and has graciously embraced this program and is helping us market it across the country. So Rob, introduce yourself and talk a little bit about Aetna and how you see this fitting so well with our members across the country.
Well, thank you, President Yoes. Brothers and sisters, if you don't know me, my name is Rob Pride. I currently serve as your National Chairman of Trustees. I've been honored to do so for 2 terms now. When this plan was brought before us and I realized the potential of what we had, I jumped at the opportunity to foster this plan and take it to the members and work with all of you to make this a reality. In a moment, we're going to introduce Steve Gervasio, which is our rep for this through Aetna. He's very, very knowledgeable in regards to the insurance realm and exactly what this plan will do for our members. But brothers and sisters, I just wanted to share with you how exciting this plan is and some potential that we have with this. If you're like me, there's a growing number of members across this nation who do not have health care in retirement, do not have those benefits, or because of the attacks on our labor unions and the attack on our profession, are losing health care retirement benefits in their areas. And so we have a unique opportunity here with Aetna to provide you a pre-65 nationwide health care plan that will be affordable to our members. Some of the great things you're going to hear from Steve that I want to highlight very quickly are the fact that this plan will include a vision benefit, a dental benefit. The great news about this plan with Aetna is once we reach our benchmark, which we're here to talk to you about today, we will get to customize this plan. We will get to write this plan with all the bells and whistles that we think are important for our members to have when it comes to healthcare. This plan will be available for you whether you're retired or not. We believe that with our buying power of 354,000 members nationwide, that this plan will be able to compete very well with any plan that you currently get from your employer. And ultimately, it would be our goal to establish a national FOP healthcare trust and be able to provide this and compete with your current insurance providers and hopefully come into your city organizations or county organizations and make a pitch to your employer to be able to provide you with a better plan and a more affordable plan than you even get while you are working. Another great thing about this plan that you all need to know is that this is available to your spouses and to your dependents. And the beautiful thing about this plan is if something tragic were to happen and you as the member were to pass away and no longer be here with us, this plan is still available to your spouse. Your spouse could still sign up for various parts of this plan, for the various coverage plans that we have, and your spouse will always be available to reap the benefits of this great plan. Brothers and sisters, we need your help. You're going to hear today that in order for us to write this pre-65 plan, we have to have 25,000 members enrolled in the FOP Medicare Advantage plan that we already have available to members. You're going to hear how cost effective it is today. You're going to hear the great benefits of this plan. There is no reason in the world, if we have FOP members out there, both active or retired, that they aren't taking advantage of this plan and the cost savings involved in this plan. So we need your help, brothers and sisters. We need your help to get it out there. We're going to provide information to you at the end of this presentation in regards to how to get a hold of myself, how to get a hold of Steve Gervasio, and a website, a dedicated website, and a dedicated phone number through Aetna that you can call at any time, ask questions, have any concerns you have, answer, and we're happy to present this to you. So I'm honored to be with you today on this version of FOP TV. I think you're going to love what you hear. And with that, I'll turn it over to Steve.
Rob, before we do, just if I could, let me, one thing, Rob gave a good overview of it, but I think the key that our members need to recognize or understand here is that by creating this partnership with Aetna, you can go onto the market right now and you can buy Medicare. If you're Medicare age, you can buy Medicare coverage. The difference is that when Medicare coverage is offered, there is a layer of commissions that are paid to people. In this case, we went straight to Aetna, so we have taken out the middleman. So our members save money immediately by switching to the Aetna plan. And when Steve walks through this, I think you'll see just what those savings are. And when you compare them to your existing plans, I think you'll see that, we're hearing from members across the country, talking to a guy the other day that between him and his wife, they save $540 a month in their healthcare plans. So with that, Steve Gervasio is he actually works, he's an FOP representative for us, and he's working as our middleman in between Aetna and us in order to be able to work through all of the issues and do all the enrollments. He knows he's all things Medicare and insurance. And with that, I'll turn it over to Steve Gervasio so he can give you a run through of what this program is.
Thank you. Thank you, President Yoes, and thank you, Chairman Pride. You just heard the vision. The vision is to create a national healthcare solution for our men and women that are working, they're in the agency, for our men and women that retire at 52, for our men and women that have been retired for 25 years. This is a big vision. So when we went to the marketplace and said, hey, we really want to leverage our membership, we want to make sure that we give our men and women a tool when they're negotiating with their municipalities on healthcare, that they have some alternatives. So when we went to the market and we talked about the vision that the FOP had, we got a lot of pushback. It was only Aetna that came along and said, you know what, we think you can get there with us. And we think there's a pathway, but we're going to have to leverage the post-65, the Medicare population, because to get a national program for all three groups, the folks that are working for the agencies, the folks that are just retired from the agencies, and the folks that retired 25 years ago from the agencies, we need data. We need claims data. We need demographic information, and you don't have it. But because the government subsidizes the Medicare portion by 80%, we can take a shot and design some plans for you that if we can enroll a test sample, we can then use that data and back engineer and come up with some really good programs that are affordable for all of your membership. We said, all right, that makes sense, but tell us what that test sample size is. And they said, we need about 25,000. We said, all right, that's fair enough, but we're going to need some assurances. Before we say yes to this, we're going to first want to make sure that we get some price guarantees. So that was the first thing that Aetna agreed to do. They gave us a 3-year price guarantee. We also said that we want to make sure our men and women, they have an advocate that helps them through the whole process of Medicare. We need someone to be able to talk to our members when they're enrolling, but also when they get a phone call from a bill that one of the hospitals says, you know, is due, or they get denied for a claim when they're talking to the pharmacy. We don't want them to go through the battle by themselves. We want an advocate. Aetna agreed to that. We then said that we want to make sure that we have at least a nurse practitioner or a critical clinical manager. So when our members are having issues with their diabetes or blood pressure, or God forbid, they just had a heart attack, they have somebody that they can talk to 24/7 that knows their case until they're healthy and stabilized. So Aetna agreed to that, to give us a critical care manager. And it's not an 800 number, it's actually their direct phone number. We also said we want to have one plan that's got a medical benefit, that's got a pharmacy benefit, that gives some eyeglass reimbursement, hearing aid reimbursement, and that gives us that unique Silver Sneaker gym membership program. And they agreed to that also. We then said, well, look, we don't want an in-network program because, you know, our people are across the country. Our folks, when they retire, they like to go to Florida or they like to go to Arizona. So whatever this program is, it cannot be in a network. So they agreed that they would give us a national program that you could go to any doctor who accepts Medicare. You don't need any referrals. There's no pre-existing illness issues. We said, okay, that works too. And we wanted to make sure that it would be the same rates if you lived in New York or you lived in Texas, and it would be the same benefits. And they said, we'll do that, and we'll do one step more. We'll also agree to give you a volume enrollment discount. When you go to 25,000 and you now are eligible for us to start underwriting the pre-65 healthcare solution, we'll drop everyone's rates by $10 per member per month. And if you get to 50,000, we'll drop it another 10. We never heard an insurance carrier ever negotiating about dropping prices. So we were sold. We said, let's go. Can you show me the next slide, please? So what Aetna came back to us and said, look, we can design what you're asking for in something that we call a Medicare Advantage program, right? It's got a lot of simplicity to it. It's got savings, and it's really a good benefit for the rates. And what will happen is we'll give you 4 different plans, and your member, your retiree, can enroll in one plan, and the spouse can enroll in a completely different plan of one of the 4. And at any time, they can go up or down on an annual basis. So once they pick that plan, they have one plan, one ID card, and they get all these benefits with just that one card. They'll have low premiums. They'll have low out-of-pocket expenses. They'll get the clinical support that we demanded. They'll get the advocacy support that we demanded. So technically, we're going to get better health at a much lower cost. Next slide, please. So what they did is they came up with 4 different programs, 4 different premiums. And you can see it. They range from $275.52 to as low as $68.90. I'm just going to go through all 4 of them really quickly for you. So when you look at the premium with the custom RX, that covers 100% of your medical. You will have no out-of-pocket expense on medical with the premium with the custom RX. So you get a medical benefit. You also get the pharmacy. Now, we all heard about the donut hole. The custom RX plan really mitigates the size of that donut hole. You also get your vision, your eyeglass reimbursement that I'm going to talk about later on, your hearing aid reimbursement, and the Silver Sneaker program. And you also get the advocate and the nurse practitioners that we discussed that I'll cover in more detail shortly. That rate is $275.52. When you look at that program, the premium with the custom RX, and you move to the premium with the standard RX, the only difference between these 2 plans is the prescription drug benefit. The prescription drug benefit in the standard RX has a slightly different formulary and has different out-of-pocket expenses. So when you look at it, The rate difference, you go from $275.52 to $215.37. One of the reasons why we thought that made sense is today, if you're on certain medications that's covered by the premium with the standard RX, and you get 100% of the medical benefit, why not only pay $215.37 than being in a pigeonhole to pay the $275.52? But if you're an individual that needs that formulary in the custom RX, then you should pay that additional $60 to get the prescriptions that you need. When you move over to the mid-range with the standard RX, the only difference between the mid-range and the premium with the standard RX is what you're paying out of pocket for your medical. You'll have exactly the same prescription drug formulary. You'll have the same prescription out of pocket. You'll also get the eyeglass reimbursement, the hearing aid reimbursement, and the Silver Sneaker program. But your maximum out of pocket on medical will be $3,000. You'll have a 10% copay, but once you hit $3,000, you won't pay anymore. And that rate is $131.02. So somebody who's relatively healthy is going to go to the doctor, not a lot, okay, but does have medications that they do take. This could be a good program for them. And then when you look at the value plan, the only difference between the value plan and the mid-range is that you're going to pay a 20% co-insurance, and your out-of-pocket is going to max out at $3,400. You still get the same exact pharmacy, the eyeglass reimbursement, hearing aid, and Silver Sneaker. Now, what I said, what Aetna gave us is also an enrollment volume discount. So look at all of these rates. We get to 25,000 lives. Every one of these rates will drop $10 per member per month. You get to 50,000, it's another 10. So you're looking at that value plan. That would be with 50,000 folks enrolled in our program, be $48.90. And remember, if you're relatively healthy and your wife needs or your spouse has certain needs, you can take the value plan. He or she can take the premium plan. On an annual basis, you can go up or down. There's no restrictions. So if you're on the value and you need to go up to the mid-range, you can. If you are on the premium with the custom RX, you can go down to the standard RX. So you have flexibility. Next slide, please. This is giving a little more detail to the hearing, vision, and the Silver Sneaker program. So on the hearing aid reimbursement, you get $2,000 every 36 months as a reimbursement. But because we're part of the Aetna CVS family, we actually get retail discounts. So there are places like Hearing Aid Solutions and also Amplifone Hearing Healthcare. They will actually give us up to a 60% discount on their hardware, and we still receive the $2,000 reimbursement. Same with the vision. We get a $250 reimbursement every 24 months. Same thing. There are retail chains out there like iMed Vision Care where we'll get a discount of as much as 20% and the reimbursement. The Silver Sneaker program is something that we really pride ourselves in negotiating with Aetna. The Silver Sneaker program included in our premium, so it doesn't cost you any additional fee. There's up to 15,000 different facilities. The YMCA, Gold's Gym, Planet Fitness, LA Fitness. There's a host that is in this program. So let's assume that you live in Pennsylvania, you live in Pittsburgh, and you like going to Florida in the winter time. You can belong to 2 different facilities in Pittsburgh. And then when you go off into the winter time to Florida, you can belong to 2 other facilities in Florida. It's really very, very flexible. And it really supports our retirees, keeping people healthy and active. But there's another benefit that I just learned about with Silver Sneaker. They have a college savings program. If you go and you work out 7 times a month, you start accumulating saving dollars that actually can be now go to a scholarship to your children or your grandchildren, up to $3,000 a year. Now just think about that. Our highest program was $275. You working out can get credit towards your grandchild or child's college on a savings program. It's a great program. Even if it was only $1,000 a year, it's a great, great benefit. We need to take advantage of it. Next slide, please. This was the things that we really fought for. The leadership at the FOP recognized having an advocate, making sure that you had a critical care management team was critical, and also making sure that they had prevention, wellness, and at risk. So one of the things that this program provides is the prevention component. So all of your annual tests, eye test, hearing test, your wellness test, flu shots, it's all included in this program, no additional cost. Wellness, we talked about the Silver Sneaker program. They also have a 24/7 hotline. If you're not feeling well, or you have a question, or you just got a new medication and you're not sure about it, there's a 24/7 hotline you can call as a member. They also have something called the Resource for Living. That is where a nurse practitioner will actually go into your home. Again, as long as you're comfortable doing that, they go into your home. They'll actually do an audit on all your prescriptions. They'll make sure that what you're taking isn't conflicting with something else that you're taking. They'll look to make sure you don't have scatter rugs that are a risk to you falling. They'll look at your bathtub to make sure you have access in and out. They'll also make sure that you have the railings getting in and out of your home. They'll also use those resources to contact folks in your behalf to be able to put up railings. So it's a great, wellness component. And then the at-risk is what we were talking about. If you're now in your 70s, your body's changing, you're now approaching, 75, and your blood pressure now is changing, and you're fighting with the medication, they will give you a designated clinical care person that's with you 24/7, that you have their phone number that you can be talking to through that whole episode. God forbid you find out that you came down with cancer. You now have a critical care person that you're talking with through that whole process. We thought that was a very important component to this whole program. You look at the advanced, that's really the end of care. Probably the most sensitive time in one's life, when all of your family are trying to deal with the issues that you have. They have a compassionate care program that I've got to tell you, I experienced this year with my mom, and I got to tell you, there's nothing like it when they get you to a place like hospice that takes care of the last 7 days of your parents' life, and they're comfortable, and you can have the grandkids, the kids, the nieces, the nephews, all in a room 24 hours a day. There's nothing like it. These are all the additional programs that come with what this Medicare Advantage plan is that the FOP negotiated only for FOP members. Nobody else can get it. Nobody else can find it. It's only for us. But it's a pathway for us to get to the bigger vision. Next slide, please. This was the other deal breaker for us. If we were not going to go into a network, we heard all the horror stories that our members told us about the old network where, yeah, it's a great rate, but all of a sudden now you have to go to a doctor that doesn't take the plan, and now you're paying $4,000 out of pocket. Or I heard a story yesterday that, and this is an FOP member who is now enrolling in this program, he had a major broken hip, and all of a sudden his bill was close to $46,000 and he had to pay $8,000 and never knew it was going to happen. I mean, just think about that. You're in your 70s and you're on a fixed income, and all of a sudden now you have a new bill come in because your health insurance wasn't in the network where you needed to have the operation. This covers anyone who takes Medicare, any hospital, provider, doctor. If your doctor takes Medicare now, they'll take this program. So this was really important, and Aetna did this for it. It's called an extended service area. So it's a PPO with an extended service area. And if you ever go to a physician that says, I don't take Aetna, you get the Aetna team, the FOP Aetna team on the phone, because if they take Medicare, just because they might be relating this Aetna to a different program, the Aetna folks, the advocate, will walk all the way through the program with that provider and prove to them that they will take this plan because it is a Medicare program. Next slide. We, and President Yoes said this well, we did not go to a broker. We did not go to some consultant. We negotiated with the executive team of Aetna. They are our partner. Okay, there are no brokers involved. There's no commissions involved. It is Aetna and the FOP. What we need to do, and this is where we need your help, we need to make sure we provide data so we can get to our retirees. So the first thing that we're doing, and we're doing it now, we're sending an announcement letter. That letter is going to go to all of our retirees. But for some reason, when our folks enter the data into the computer, they may not put all the necessary data in the computer. So we started out with 90,000 names, which was a great list. But when we look at what the qualified list was, where you had all the information to get that letter delivered, it brought us down to 34,000. So just think about it, with 90,000 with spouses and surviving spouses, we have a market potential of 150, 170,000 names. So we're asking you to help us. Maybe we can't do it for this year. We're starting with the 34,000, but boy, if we can go in, make sure that everybody's data that's in our files is updated and accurate, that would be tremendous. The other thing that Aetna has done for us is they've given us a high-tech website. That website covers every issue. We've got to get our retirees to the website. And if they don't like the internet, we have a designated call center that's FOP trained. It's FOP Aetna Call Center. They're not salespeople. They're not marketing people. They are our advocates to help our members through the process. But we need your help to get the message to them. So one of the things we're asking for everybody, we have a link that we can put on your website. So this way people can easily find the FOP Aetna website. We also have a team of social media experts at Aetna. They have all this content, all these logos that we can attach onto your Facebook page, or you can attach on your Facebook page and Instagram. So we now, just think about it. We have over 2,200 local lodges across the country. What do you think that would look like getting a message out if we had the link on everyone's website, if we had the social media content going out? It would hit everywhere. And here's the other thing it would do. Every other union, police union, is going to say, how come I don't have that? And if they're a member, maybe they'll decide to become an FOP member versus an IPO or a PBA. It works as a great marketing tool for us, but we need your help. So Aetna will handle everything. They'll help get the mailing out. They've already set up this website. They have the call center. When someone enrolls, they'll get an enrollment kit. Okay, we've actually set up bi-weekly webinars that Aetna has already put together, that we're working together on for our retirees. And as you can see, we have an actual mailer that will go out and an email that'll go out that'll talk about these webinars. We need to get it in front of our retirees. And there's also other information they'll share, like the Able To program, which is designed for PTSD members. And then again, you'll see the last chance mailer. Next slide, please. So there's two groups that we're always talking to, right? There's the group that when they retire, and they're now 65, they're on the individual market. They get no subsidy, they get no stipend, they get no bargain benefit. They are on their own. They're trying to talk to some broker. They're getting inundated with marketing, mailing material, talking about join up today. Those folks can go today. If they are already 65, they can just enroll. They can enroll today. It starts 1/1/21. But if we have members that are 64 years old and ready to turn 65, they too can enroll in this program, or their spouse, or their surviving spouse. Enrollment actually started on Monday, August 17th, and it will continue until December 4th. We really want to find out, if you have members that don't like the web, that want hard copy marketing material, either call Rob Pride or myself, send us an email. Aetna will send you a box of marketing material so you can pass it around. These are the dates that you see listed that we're going to have webinars. We need to get these dates to the retirees as soon as we can. Now, let's assume that you're not one of the 70% that's on your own, that you're one of the 30% that's getting a bargain benefit, a stipend, or a subsidy. We can still help drive your costs down. If you're part of a health trust fund, reach out to Rob Pride or myself. We have programs that we can drive your costs down and also get credit towards our goal. Let's assume that you have a municipality that provides you health care in retirement. You're one of the fortunate folks in New Jersey. In the state of New Jersey, you get a bargain benefit. You get Medicare and a Medicare Advantage program for life, you and your spouse. When that RFP is coming up, just let us know so we can bring in the Aetna folks. They can then respond to that RFP, and if they win that RFP, we get the credit. So this program's designed for both our 70% that are on their own on the individual market. It's designed for our associate members, our members, our spouses, and our surviving spouses. It's also designed for the fortunate that were lucky in their negotiations years ago, that are getting a bargain benefit, stipend, or subsidy. Next slide, please. This slide has Rob's information, has my information, it has the FOP Aetna website, and it has the 866 FOP Aetna Advocacy Call Center. Just reach out. I want to thank everybody who came to the FOP TV to listen to this broadcast, I guess it would be called. I also want to thank President Yoes for his great leadership and really driving the process, and Rob Pride, who's taken the lead and making sure that everybody knows about this program wherever he goes. Thank you.
Steve, I appreciate it, and great information, and I think our members have to be pretty excited to see that we've been able to get so much added into this policy to give our members benefits that they can't get elsewhere, and at a rate that they can't get elsewhere. But let's talk just briefly, if we could, about the post 65. Our goal is to get 25,000 Medicare recipients, Medicare people members into this plan. And we are on path to do that. As of right now, this is the first week of enrollment, and we're about 5,000, somewhere in that neighborhood. So we're already 20% of the way to achieve our goal. But let's talk, if we could, just briefly about what is our longer vision of how we get there. How is the plan going to be developed, and how is that going to benefit our members that are pre-65? If you could talk just briefly on it, on a process of once we reach that point, what will it trigger, and when will the pre-65 plan take effect?
Yeah, those are two great points, and thank you for asking. And I just want to make sure the audience recognizes your vision is bigger than that. Your vision is to make sure that even the folks that are in the agency working, that we would have a program for them. So when they're negotiating healthcare, and their director of human resource or director of finance says, hey, we're paying way too much for healthcare for our men and women that are on the job, we're going to have to take some money away from our retirees. We're able to go there with the FOP national program with Aetna and say, here are our rates. So if you can't get better rates than these, then you need to come with us because we'll drive the price down. That's one point I want to make. The second point is there's a process that we're going to go through. We get the 25,000 lives. We now have all of that claims data. We're going to then put together our group, our committee, who's going to start saying, what do we want the health package to look like for our men and our women? What do they need? And we're going to get that feedback from the membership when we put this committee together. And then we're going to go sit with the Aetna underwriting team. And we're going to then start going through what our numbers are and really start putting together the dollars and cents, because we think we can prove the point that our retirees, because of different legislation that we have with either heart, lung, or cancer legislation, we're actually a healthier population. And we think with the level of the size of our group, with our program, we should be able to put together a program like we did that will have 3 and 4 different options, family options, individual options that will include, like what Rob said, it'll be like almost like a pick and choose. If some people may not want dental, but the other people may want dental. You know, other folks may want some other features and benefits. And that's what we'll create with Aetna. We don't know exactly what the rates are going to be today because we need to put together this claims data and really start showing Aetna where are the people coming from enrolling. That is going to start becoming some of the issues. Where are they coming from? How many folks? What is the population? And that will then give us the opportunity to put together some real good rates and options.
Oh, great.
I think I answered the question.
Yeah, you did. And Steve, I think it's important to note that we're talking about 2 different entities here, or 2 different paths here. One of them is the pre-65, which is going to get us to the post-65. One of them is a Medicare, and the other one is a health insurance plan for our members and their families. And we need to draw a distinction between the 2. One of them is a defined plan by Medicare. That's the out-of-network. That's all of these things that are factors that are important. The pre-65 is going to be, pre-65 is going to be slightly different in that it's going to be based on regional markets and what the cost of healthcare is in those markets. So there's not going to be a flat rate. It is one that's going to be developed by our members sitting down with that and telling them what we would like for that plan to be. So I just want to make a distinction that when we do the second part of this, which is the pre-65, it's not going to look exactly like the Medicare. They are two different paths. The other thing, and just point out, you know, our members are working for agencies across this country, and healthcare has always been the big challenge of what's the cost of healthcare. And it may very well be we may find officers that stay with their agency's healthcare because it makes sense to do it because it's a benefit they have. But this may be a better benefit for their family coverage. So there's a lot of factors here in play. And Rob, I'm going to ask you. You know, we've been traveling across this country, been talking to our members, trying to build some excitement, anticipating the open enrollment period, and just give some great feedback. Can you talk a little bit about some of the feedback that you've received from our members across the country on both the rollout of the Medicare Advantage plan that we have, and then also our bigger view of having the pre-65 plan?
Yeah, I'd be happy to, President Yoes, and overwhelmingly the response about the Aetna program as a whole has been one of excitement. Folks are excited. I think we have a lot more members out there who do not have a healthcare retirement benefit than we do of members that do. And so I think folks are excited for this plan. Our members are excited to have an affordable healthcare option, period, whether it be in retirement or not. I think we've all seen the rising cost of healthcare across this country skyrocket over the last 5 or 10 years. And so I think for us to be putting forward an option where folks will be able to have a really good healthcare plan and be able to afford it because of the buying power we have with FOP, overwhelmingly excited. I think a lot of folks, and that's why we're here today on FOP TV, they haven't heard about it yet. So a lot of the states that we've gone to where we've talked about this plan, folks are excited to hear about it. They're surprised that we have this out there, and they're willing to get it forward to our members and to the retired members so that we can reach that benchmark. So overwhelmingly, I think the sentiment is one of excitement. one that wants to see this happen. And together, brothers and sisters, I think we will be able to do that.
Thank you, Rob. And our goal is by December to reach our 25,000 and start working on that plan. When we reach that, not if, when we reach the 25,000, the goal is as far the coverage year of 2022. We will have this plan in place for the pre-65. So with that, the numbers are on the screen. They've been there for a while. Call the advocacy numbers. Call Steve Gervasio, call Rob Pride if you have any questions specific for your lodges, and let's really dial this down. But also, I'd ask you to please go out and be an advocate for this. The bigger vision of where we're going in this benefit, how it's going to benefit our members, really is dependent on you, each and every one of you, of helping us promote the fact that we have an excellent benefit we want to share with our members. We want to make their lives, more stable. And in order to do that, this is a huge step in that direction. So please take some time and not only consider purchasing this insurance. If you're on Medicare, you're going to get Medicare a plan somewhere. Take a look at ours and you'll be surprised to see what the cost savings is. That's been the feedback we're getting across the country. But more importantly, make sure our other members know about it. Our past members, invite them to come back and take advantage of this. Let them save that cost savings. Surviving spouses, let them know that this benefit is there. If they were an FOP member, if they've got that connection where they were linked to the FOP, they would be eligible for this too once confirmed by their local lodges. So help us promote this plan. Help us help you and provide an outstanding benefit for our members. So I'll finish up and say, we're very proud to offer these weekly episodes of FOP TV on demand. You're going to, when this is done, you will receive an email because the way you're registered, you're going to receive an email, and that email is going to give you the ability to get some material that we're going to send off to you at the conclusion of it. But keep an eye out. You're going to see an expansion every week. We will have a new video out for you that gives more information about today's climate and law enforcement and the benefits that we offer our members. I wish everybody the very best. These are some tough times in law enforcement right now, but we're true professionals, and this is not the first time we've faced adversity. And every time we've shined through as the leaders that we are in our communities, and we make a difference in the lives. So I thank each and every one of you for your role in doing just that and in picking this noble profession, and wish all of you very well. Thank you very much.